Assalamualaikum warahmatullahi wabarakatuh and a very good morning. Today is Friday, 30th of October. Yesterday was Maulidur Rasul, birthday of our Prophet Muhammad. Kita selawat kata Rasulullah, Allahumma salli ala Sayyidina Muhammad. Okay, today I'm going to share one medical topic which is not surgical topics. As you know, I am a qualified surgeon, but today I want to discuss and share with you about cholesterol. Funny, isn't it? So since I am not internal medicine physician, I just give you simple way of understanding your cholesterol value. Okay, when we do cholesterol, okay, normally if you are below age of 40 and you are asymptomatic, there won't be any screening about your cholesterol level, provided you being treated for hypertension, diabetes or heart diseases. So other than that, you are not going to be tested for cholesterol. Okay, suppose then the risk increasing once you become aging above 40 and you started being tested for screening for your health status. Okay. What is the parameters in the cholesterol screenings? Basically, when you see a layman go and see the doctor and then they have hypertension, so they being investigated, including this lipid profiles. So they've been told that patient have high cholesterol, and they are not every doctors will explain what is inside the breakdown on the cholesterol values. So they if they have hypertension, aging, and normally they will be advised to be started on medical treatment such as statin. Okay. Alright, let me tell you how how the cholesterol be interpreted. There are 4 levels of interpretations. Okay, in the lipid profile, these are the 4 main parameters that will be printed. One is total cholesterol, second is triglyceride value, third is HDL, high density lipoprotein, and 4 is low density lipoprotein. They call it as a bad cholesterol, HDL good cholesterol, triglyceride fat, and total cholesterol. So in level 1 interpretation, they already then people have higher cholesterol level, means 5.2 and above. 5.2 to 5.8 is considered low, moderate increase, and 6 and above consider high. 6.5 and above consider very high, like that. Okay, so these are just level 1. What is level 2? Then if you are educated and you are aware about there are other things to be looked on, they will mention to you about LDL Low Density Lipoprotein. This is a bad cholesterol. Okay, if you have high LDL, basically it is because of diet that you have been consumed for the last 20, 30, 40 years. It's what you eat actually. And the the risk of you developing coronary heart disease and stroke is higher. Alright, it's higher. So these patients are advised to cut down the cholesterol containing food, exercise, reduce intake of carbohydrates, takes omega-3, and do this and do that. Okay, that is if you that is further detail in cholesterol. Means if they explain to you about this, is good enough. Okay, then the third level of interpretation is by mentioning about the other type of cholesterol, HDL as well. So high density lipoprotein is a good cholesterol, high density, alright, in which there is no way you can increase the HDL. I mean, this is the only type of cholesterol where we need it to be higher. The rest we want it to be lower. I mean, total cholesterol we need to be low, low density lipoprotein, LDL we need to be low, and triglyceride we need to be low. And we need to have this thing controlled. So HDL we need it to be higher. So HDL value is to be at low risk of developing heart attack, 1.6 and above. And if you have less than 1, you are at high risk of developing heart attacks and also strokes. So how to increase the HDL? I will tell you, or maybe I tell you now, is only by moderate intensity exercise. Means you have to exercise in which that type of exercise sustain your heart rate more than 100 for 30 minutes. So your heart rate must be sustained for 30 minutes, more than 100 beats per minute. So you have to do it minimum of 3 times a week, 90 minutes, or if you can do 5 times a week, is superb. So the only way to increase HDL is by means of exercise. There's no medicine can increase the HDL. Even if you take statin, there will be slight increase. But to get it sustained, to be at low risk of developing heart attack, you need to maintain this type of moderate intensity exercise. LDL just now, I said is based on what you eat. You are what you eat. So it can only be reduced by taking statin and control your diet plus a bit of exercise. That is level 3 of explanation. What is excellent explanation? So level 4. This is what I want to add. It's not complicated. It's a bit of input and knowledge about the whole things. So in level 4, we mentioned about the LDL, HDL, total cholesterol, and we also mentioned about triglyceride value. And there are 2 additional things which is actually the determinations of is more sensitive and determine people whether you are at risk of developing heart attack and strokes in futures. So that is the ratio between total cholesterol to HDL, which you need to get less than 5 for you to be safe, or 3.5 to be in excellent conditions. And another one is ratio between triglyceride to HDL, same value, less than 5 or 3.5. Okay, let me start telling you about LDL. Majority of laymen and even we as a medical fraternity, medical doctors or staff think LDL is bad. Yes, LDL is bad. LDL value in your results actually telling you the total the amount of low density lipoprotein carrying cholesterol in the bodies. Actually, there are there are types of LDLs. There are many types of LDL, but basically the easiest way, simplified version, is LDL cholesterols, and another one is LDL particles. So LDL cholesterol that being printed and then displayed in the blood results actually is a type of cholesterol with bigger molecules, and this actually harmless to the body. Okay, the study have been shown if you Google through and read the literature review, and this LDL cholesterol actually does not have direct impact in the pathogenesis of atherosclerosis. They don't really injure the arterial wall. They don't really trigger the formation of atheromatous plaque. And you have another one, what we call LDL particles. This is a really bad cholesterol, which is small density. And this LDL-p carries other elements in the body apart from other than cholesterol. So what they carries? They will carry other particles other than cholesterol and mainly triglycerides. So now triglyceride comes to play. Okay, triglycerides is actually bigger molecule than cholesterol. Bigger molecule than cholesterol. So LDL particles actually will actually trap more triglycerides in favor of more triglycerides. So if you have higher number of triglycerides, then more LDL-p will be present in your circulations, because you need to carry cholesterol further, isn't it? And this LDL-p combined with triglyceride is believed to be the main causating factor of atheromatous plaque formation. So they said by one of the theory mentioned that this LDL-p containing triglyceride will stimulate the release of proteoglycan, and this will enhance chemical reactions will lead to the formation of atheroma and further causing clot in your artery. So what is the safe value of triglycerides? You need to be in that parameter they mentioned less than 1.7 is considered good. 1.7 to 2.7 is considered mild risk. 2.7 above considered high risk. So you need to have it low. Alright, you need to have it low. So the higher triglyceride number, the higher LDP will be in their body. Alright, the higher LDL-p, which is small density like LDL in the body. So triglyceride, is a form of fat, and usually associated with patient with diabetes mellitus and also patient with higher fat in the body. So if you can cut down your fat, exercise more, cut down the intake of hyperglycemic food, food with hyperglycemic index, there will be no excess carbohydrate in the body, and there will be reducing the amount of triglycerides. So knowing this, then come into the picture of the triglyceride to HDL ratio and total cholesterol to HDL ratios. So this is actually how we monitor ourselves. I'm talking this for those who are asymptomatic. Asymptomatic means you have no hypertension, you have no attack of heart disease or chest pain, you have no risk factors, means you have no diabetes, you have no smoking, you are not hypertension, you are not on drugs. If you have no all these risk factors and you bump into your cholesterol value and your cholesterol is high, don't get panic. So that's cholesterol high, don't get panic. Look into the details of your cholesterol parameters. I'm talking about the patient which is asymptomatic. So for normal healthy individual which is asymptomatic, let's say your LDL you are expected to have it below 2.6. Below 2.6 we consider good, excellent. And not many people will have that kind of things. And not many people, unless you're completely vegetarian or what. LDL is, like I said, is what you ate for the last 30-40 years. So if you are healthy, for healthy individual, even cholesterol 3.5, which is, I think, majority of nation we have about 3.54 because of the food that they take. So look at the ratio. I just give you example. One person with normal cholesterol value 5.2 for example, and they have LDL 3.8, which is high, but don't worry about that. So you have 5.2, you have LDL 3.8, and they have HDL 1, 1.1 for example, because they are not actively involved in sport. So you see the ratio, 5.2 divided by 1.1. Okay, the ratio is 5, right? 5. So you are expected to have the ratio of total cholesterol to HDL less than 5. You are supposed to have that. This is less borderline, less than 5. And you have normal total cholesterol value, but your risk is just about 5. Ratio is 5.1. So, and at the same patient have TG, triglyceride value about maybe 2 and 2.2 for example, and you divide it by HDL, they have 2. Okay, they have 2. So TG to HDL, you must have it, keep it less than 2. So 2.2 divide by 1.1, 2. It just borderline. Actually, it's not good enough. So that patient just now, cholesterol value is 5.2 with LDL 3.8, HDL 1.1, and TG2. So they actually just on par to be as a guideline, as a calculation measure, that you need to keep it below 5. Alright, this is the patient with normal total cholesterol. I put you another patient, total cholesterol 6.5, and he is actively involved in moderate intensity exercise. He run, cycle, he swim, he do skipping, play badminton, he play soccer. So his HDL value, he has total LDL about 3.8 or 4, 3.9, but HDL value is 1.7. Because of he involved in this kind of moderate intensity exercise, he cut down his fat and his total glyceride 1. Some of them may be less than 1. So you see the ratio here, 6.5 divided by 1.7 will give you a value of 3.7, 3.8, which is good. To be in excellent condition, you must have it below 3.5. Less than 5 is your target. Get it below 3.5 is better. So 3.7, 6.5. If you 6, for example, 6, your HDL 1.5, you get 6 divided by 1.5, you get 4. It's 6.5 divided by 1.7, you get it less. And then TG to HDL pula. TG, I said just now 1, HDL 1.7. It's less than 1. So these people, this another patient with total cholesterol of 6.5 actually is having healthy life and low risk of developing coronary heart disease and stroke compared to another person just now with normal value of total cholesterol because of the ratio. Can you see that? Yes. So I hope you are you get something about how to interpret the cholesterol. And remember this, you need to know your HDL, You need to know your total cholesterol. You need to have this total cholesterol to HDL ratio, and you must achieve first below 5, and if you can have that, you must continue to pursue the ambition to get it below 3.5. Then you are at low risk of developing heart attack or heart disease. Okay, and then triglyceride value also very important. Apart from another indicator for insulin resistance, this triglyceride, you keep it low, and then you have ratio TG to HDL less than 2, you are moving into the right directions. Of course, you need to keep LDL low, but for patient on treatment, for example, patient had done angioplasty, bypass, specifically they need to be kept below 2.6 LDL, and this patient definitely on statin. And otherwise, if you're healthy, you can exercise, you can walk. Looking at your age, you have no symptom, you are not smoking, you have no chest pain, you have no hypertension, you can live with LDL 3.5 to 3.8, for example, but you need to keep your HDL high and TG low. Alright, understand about that? I hope me as a surgeon telling people about cholesterol, but I think that is the easiest way. If you want to monitor yourself, you can look into this ratio, look into individual things. And if you want to increase your HDL, do moderate intensity exercise, 30-minute exercise, heart rate more than 100, maintain for 30 minutes, do it minimum 3 times a week. Plus, control your diet, take more oats, omega-3 whatsoever, cut down this polyunsaturated fatty acid, trans fatty acid, which present in all this junk food. So you cut down this thing, eat like normal people eat, we cut down the number of carbohydrates, you will be alright. Stay healthy, exercise a lot within your capabilities, and we save you from taking medicine. And another thing, there is a heart risk calculator. You can just type heart risk calculator from American Heart Association, ACCVD calculator, in which you can monitor the risk of you developing coronary heart disease in 10 years times, including strokes. So you enter your name, age, systolic pressure, diastolic pressure, your origin, whether you are Asian or American, and then your total cholesterol in milligram per deciliter. So you have calculator to convert millimole to unit, and the HDL value, and then the column to be ticked, smoking or not, diabetes or not, hypertension or not. So you enter, you click. So they will give you the percentage of you developing coronary heart disease and stroke in 10 years time. So in that formula calculator, they put a cut point of 7.3%. If you have everything normal apart from just cholesterol, and then you have good HDL, you can keep the risk 3% and below. So with that, they suggest you are not benefited from taking statin, you are not benefited from taking aspirin, you are not benefited from taking hypertensive treatment. Just maintain your moderate intensity exercise and good diet. But this increases by age. As your age increases, for example at 40, 50, 60, it will increase, the percent will increase. So by the time you reach 60, and you still can exercise, the most you will take is maybe statin. Or you can maintain slow jog, run fast, swimming, you will be healthy. And keep your knee strong, keep your legs strong, and continue exercise, inshallah. Assalamualaikum warahmatullahi wabarakatuh.